Heartworm disease is a problem that primarily affects dogs, but can also affect cats. It's a parasite that gets into the animal's heart. It causes heart failure on the right side, it causes lung disease, kidney failure, and is normally fatal after a certain number of years. Carried by mosquitoes. Mosquitoes bite infected dogs, and then the mosquito will take that larva and it will bite an uninfected dog, transferring the heartworm larva to the new dog. It takes about 6 months before those heartworms have matured enough to get into the new dog's heart, and then you have a patent case where these heartworms are breeding in the heart and spreading their larva throughout its body to be picked up by another mosquito and brought to another animal. Heartworm is treated with a series of injections. First, you have to stabilize the patient because they can do so much damage. The kidneys and the lungs and the metabolic function has to be monitored very carefully. The injections are expensive, they're painful, they're given at hospital, and we have to monitor the patients very closely afterward. The treatment takes 3 months. There's an initial injection, a quiet period, 2 more injections, another quiet period, and then follow-up testing afterward. We need to get that patient right onto heartworm preventative as soon as possible so that they don't get any new heartworms and that the other heartworms, the heartworm larvae, are not transferred to another patient. Here in Georgia, heartworms are extremely common. Our prevalence down here by the American Heartworm Society, we are one of the dark colors here in Atlanta, but the whole southeast is full of heartworm. You can catch this at any time during the years. Our summers are warm and our winters are mild enough that mosquitoes can fly at any time, and heartworm is transferred year-round here in Georgia. Heartworm prevention is extremely simple. There are monthly pills and chews that the dogs and cats can eat that are simple. There are topical monthly treatments for heartworm that will prevent it and also treat other internal and topical parasites. Prevention is really the way to go. You have to do it year-round. Here in Georgia, the climate is so mild that heartworm is prevalent and transmissible all year long.